Welcome to The Point, a podcast by Apex Benefits and dedicated to employee benefits thought leadership. You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.
All right. Well, we're here today with Kelley Carlstrom, and she is our last but certainly not least in our podcast mini-series here at Apex Benefits, focused on the past, present, and future of pharmacy. So shocker, she's going to share about the future of pharmacy because she's already working in it today. We're really focusing around digital technology. And Kelley also has a great clinical background within oncology as well. So I'm not going to steal any more of her thunder. I'm going to welcome her to the show and ask her the same question that I ask all of the guests. How did you get to where you are today in your own career, Kelley?
Thanks for having me, Erin. Yeah, my career, I'm here because I took a couple of really interesting detours. I started my career fast track through residency training. So I did 2 years of residency training that led me to a traditional clinical specialist position at a large academic medical center. So I was in a direct patient care role in oncology. I had great opportunities to work with some fantastic colleagues, pharmacy colleagues, medical, nursing. I was knee deep in direct patient care, which I absolutely loved. Interestingly, just a couple years after residency training, I realized that I was at the top rung of my particular career ladder, and I couldn't scale how many more patients I could have an impact on. I could only see so many patients in clinic. And I didn't realize how many other career ladders were out there. I was on my particular trajectory based on my residency training. So I didn't know what I was looking for, but I knew I wanted to leverage my clinical knowledge and my interest in learning different skills. So I had an opportunity when a recruiter reached out to me on LinkedIn, which is why I'm such a big proponent of LinkedIn and more pharmacists need to get on it. And I had an opportunity to step outside clinical practice and see this bigger view of healthcare and how we can use our skills.
Awesome. So I wanted to ask you specifically, I always like to talk about certifications, certificates, board certifications. I know you have one of the rarest, and I think hardest board certifications to get in oncology. So can you describe a little bit more about what it takes to become a BCOP?
Yes, board certification was the culmination of my clinical training. I took it after I finished residency training. And for a lot of clinical roles today, it's an expectation. Interestingly, I have found it to have the most value in my non-traditional roles. So I was talking with another BCOP that I worked with years ago, and she was telling me how she's thinking about not renewing her BCOP certification because although there's a push for it in clinical practice, there's not an additional reason to kind of keep it up outside of our own professional development. So I think that's one reason. I know you've talked about it or posted about it a lot on LinkedIn about how we can continue to enrich our personal skills, work on our professional development. I think that's a great reason to get board certification, is to keep you up to date with what's going on in your specialty area. But what's been really valuable for me is using it as a talking point about my baseline competence with non-healthcare people. So board certification is a term that a lot of people know from our physician colleagues. I think the first board certification was in the 20s or it's obscenely long ago. Mm-hmm. And we can really leverage that information that the general public has to our benefit when we're talking to people who are unfamiliar with the expertise of a pharmacist, which we know there are many. So I find a lot of value of it in these non-traditional roles. And actually, this was my first recertification year. So I got to recert by exam during 2020, which was an interesting experience.
Yeah, it's, I think I updated the spreadsheet on certifications and certificates, and we're over 300 now, which just blows my mind. Because when I graduated from pharmacy school, and I am not going to say what year that was, we didn't have those kinds of options. I mean, barely board certifications seem to be around. So I'm excited, like you, that we can kind of, niche down into specific areas of practice. And you are at one of these really cool, I argue, future focused, but you get to work in it every day, intersections between oncology, kind of the IT world, and pharmacy, because you're recording this today from the San Francisco Bay Area. So you are in the middle of the tech Shangri-La, if you will. So because you're part of the future conversation for this podcast mini-series, Kelley, where do you see this interesting intersection that you're clocking heading?
Yeah, I think this triad is really going to be deepening. So we've got oncology, the clinical area of oncology that's rapidly evolving. We've got the technology side that's also rapidly evolving. And we've got the pharmacy professional side, which is rapidly disrupting and needs to rapidly evolve. So this triad is really interesting for me. I love this intersection. First, with oncology, there is so much going on in oncology. And this is one reason why I recommend other pharmacists get interested in specializing in oncology, because the future is here. We have the most clinical trials in oncology. We have the most drug approvals. And not only do we have the most drug approvals, but we have the most complex drugs. We've got really interesting drugs coming to market. We have the most expensive drugs. And we have a vast amount of literature published regularly. We have a need for data wranglers, which is a term I heard at a digital conference a couple of weeks ago, which I love. There's so much data out there. Even if my full-time job was to keep up with the data and understand what's going on, there's no way you could do it. There's so many journal articles published. Abstracts alone, if you've ever been in a situation where you're searching through ASH abstracts, the American Society of Hematology, it is a beast. There is so much information out there. So I think the clinical area of oncology is pretty well known that it's rapidly evolving. The second tier or kind of point of this triad is the technology piece. And I think we think digital health is kind of the future of healthcare, but it's actually here right now, today. And technology has been routinely slow to infiltrate healthcare, really slow. I think those of us who've worked at healthcare institutions know it's like trying to turn the Titanic, or incorporating new technologies like molasses in winter is another good analogy. It just takes a long time to get into these organizations. But I think the healthcare institutions and the healthcare broader community is recognizing that there is an increasing amount of value in technology, specifically in certain niches that relate to patient outcomes, for example. The challenge with technology is these technology companies can't do what they're doing in a vacuum. They need clinical input. I think we can't make a technology product with a bunch of engineers that don't have any healthcare experience or don't know about the workflows or the pain points or the challenges that we all face every day. So we need clinician input, and that's one reason why I'm really interested in this intersection. And I think pharmacists have a lot of opportunity in the digital health space now and in the future. So that third point of the triad, the pharmacy profession, we know there's a lot of challenges going on in pharmacy. I believe that we are a huge untapped market of skilled professionals. We are all highly skilled. We have the best high-level view of the healthcare system, the bird's eye view of all the systems and processes. We see when orders are entered. We see the errors that happen when orders are entered. We are involved in the verification process, order verification, product verification, compounding, the delivery of the medications. We're answering questions about administration. We are dealing downstream with payer issues, patient counseling, patient affordability. Like, we see a broad view, and this is why I think we have such an opportunity to impact. Now, a lot of pharmacists do practice upstream in this process. This is what I did when I was in clinical practice. I was in a physician clinic, helping make decisions at that point of decision making. But the vast majority of us practice downstream. So we're dealing with the parts of the process after a medication has been ordered, for example. So we're seeing the payer rejections or the prior authorizations, or the patient that has a $1,000 copay on oral chemotherapy. So I think there's opportunity there to move us more upstream in the drug use process. So I'm really excited about these three pillars of the future.
Yeah, and I love that play-by-play that you just gave us on the triangle there, Kelley, because our audience are employers. So they're cutting the checks for a lot of these, high dollar chemo drugs, and they're often hiding out over in the medical benefit. They're not even over in the pharmacy benefit. So thanks for breaking that trifecta down. And I guess we need to back up a little bit. You work for a company called Project Ronin. Can you talk a little bit about that project and how it kind of blends this intersection that you're kind of clocking traffic at?
Mm-hmm. So Project Ronin is a healthcare technology company, and we are focused on really three core pillars. The first is something called human-centered design, which I didn't know a lot about until recently. And I think the reason why it's so important on the technology side is that what we've been using so far in technology and healthcare has been very poorly designed. And I think that has led to a lot of the challenges that we face. So we've had EMRs, electronic medical records, forever now, long time. But they were never built in a way that was meant to be useful for the clinicians. They weren't made to be easy to use. They were made to bill, to collect revenue. And so I think we've lost this design piece, or perhaps we never had sight of it. But now I think it's much more important these days that we have a seamless design of technology products, not just for clinicians, but also for products that are patient facing. So that's one of our core pillars that's really important is design aspect. The second piece is partnering with cancer centers to get that clinical input that I mentioned is so important. So we want to partner with not only large academic centers, but small community, regional practices, because the ability to treat cancer patients is very different across the country. And we want to get that input and use that to inform the products that we're making. And then the third piece is our strong data science team. So I mentioned we've got all this data in oncology. We need to wrangle this data. And so we need to build models and decision support algorithms that bring all this information to the clinician to inform decisions that they're making. So not just all the literature out there, but also the patient outcome data. How can we summarize and use the information on our pool of patients to help us make decisions for other patients? So that's what we're focused on.
Yeah, thank you for that recap. So when you're thinking about our audience, so employers, they're trying to do the best they can for their benefits for their employees, particularly in your area of expertise within cancer and oncology. We often know that these can be really high dollar claimants. What's your best advice there when you're particularly with a self-funded employer who's cutting the checks? Is there something around oncology and advice based upon your expertise that they should be looking for when they, provide these benefits to their employees?
So I think, cost in oncology is such a giant area to tackle. I mean, there's a lot of challenges in oncology for sure. The traditional cost levers that we've had are still in play and still are used today. So formulary management, whether drugs are covered or not, network management, whether your provider is covered or not. So I just moved to the Bay Area, as you mentioned, and I'm back with Kaiser. I had Kaiser years ago. I was an intern at Kaiser. So, Kaiser is one of the example health plans that restricts provider networks. And then we also have prior authorizations, which a lot of pharmacists are very familiar with. There are also specific programs in oncology, like split fill programs that are not necessarily new, but are not really widespread either. So for those that don't know what those are, if you have a patient on a very costly oral chemotherapy, say it's $10,000 a month, we're not sure how well the patient's going to tolerate this therapy. Chemotherapies are not well tolerated in general, some better than others. How can we manage that process to ensure that there's little drug waste? So one way to do that is through these split fill programs, where instead of filling a 30-day supply, you fill, say, a 14-day supply. and you assess how the patient is doing on this therapy before the remaining prescription is filled. The challenge with that is, of course, the logistics. So a lot of these high-cost drugs come through specialty pharmacy. They are shipped to the patient home. So how do you manage that process of getting the information in from the patient in real time and being able to pull the trigger on the next fill so there's not a delay in care? So we don't want that to happen. And I think that is an example of how we should be thinking about pairing technology with clinical care to manage outcomes and costs. So one component of this is what are called PROs, patient-reported outcomes. So this is when the patient gives us information in real time about their symptoms. So in the example of a new chemotherapy, we could see how that patient is doing in the first week and a half on therapy from their own mouth. PROs mean it's not filtered through a clinician. And we can use that information to make decisions in their care afterwards. But we also need to bring other benefits from that report of that patient. So not only can we get the information from the patient, but we can remove some of the ambiguity that the patients may feel about what is expected from this drug and what is not expected. Should I be having abdominal pain or should I not be having abdominal pain? When should I call my doctor? So technology can help remove that ambiguity. Also, we can get the clinician involved. We can send that information to the clinician in real time so they can make decisions. Maybe the patient needs an outpatient prescription to help manage that side effect. Maybe if it's delayed long enough or if it's severe enough, they have to be admitted. So technology can play at that intersection between clinical care. I think there are also some really interesting technology platforms and products that are being used today, but I'm sure are also going to be expanded. And we can use those to help track and kind of trend what's going on with our patients. So think about all the devices that we wear today. So I've got a smartwatch on. A lot of people probably do too. How can we use this data? So if I could get information on my patient's temperature, how could that help me? What if I trend temperature over time? What about the patient weight? Is their weight going up? Do I expect it to go up? Do I want it to go up? Is it going down? Blood pressure. A lot of drugs cause high blood pressure, but I'm also cautious about low blood pressure. EKGs. Do we need to know EKGs? We have a lot of technology that's coming out with wearable EKG devices now. What about activity? So not just daily movement. So your patient that's just been discharged from the hospital, are they getting around or are they in bed all day? But also exercise. Are they getting enough exercise throughout the day? You know, exercise is one thing that can combat fatigue with chemotherapy treatments. What about sleep? We know sleep is so important, and yet most of us don't get enough of it. Mental health issues, stress, anxiety, depression. How can we keep better tabs on that, better manage our patients? Medication adherence, supporting tobacco cessation. Like there's all these technology products that we can bring into the care of this patient to help manage overall outcomes and costs.
So the future really is here today in a lot of respects to the points that you just made, Kelley. So thanks for sharing those and breaking them down, particularly in oncology. Let's back up, talk about pharmacy as a profession. What do you think pharmacy needs more of?
I think we need to think bigger, to be blunt. I think we need to be more innovative. We need to take more risk. We need to challenge everything, start asking the questions, why do we do things the way we've always done things? I think a good word that sums it up is we need to be scrappy.
Scrappy, I like that. What do you think pharmacy needs less of?
I think the obvious one is that we need less dependence on our dispensing model. I think we also need some less thinking that some specific event is going to save our profession from the disruption that's going on. So whether that's fixing reimbursement issues or provider status, like these things will help, but I don't think either are going to fix everything because healthcare is fundamentally changing.
If pharmacy's future depended on one thing, what is that one thing based upon your area of expertise and how do we get there?
I think pharmacy's future does depend on one thing, and it is the ability for us to demonstrate our value. We have a lot of knowledge and skills. Even if we don't have specific knowledge, we can go out and get it. To your point about all the certifications, more than 300 certifications, you can learn lots of things. And our profession is a profession of self-learners. So we have skills that can improve outcomes. And we're being asked to take on more and more, but we need solutions and we need tools that are scalable. There's only so many patients we can call per day. There's only so many prescriptions we can fill per day. So many patients we can see in clinic per day. So how do we leverage solutions and tools to scale that, to have a bigger impact? And I think one place to start is teaching more business practices and curriculums. I haven't been in school for a while, so I'm not sure if how much of that's being taught today, but I think we need more of that business side of healthcare, and to really help us reframe how we think. It doesn't feel comfortable to think about healthcare as a business, particularly in oncology. Like, hey, we got here to take good care of patients, but healthcare is a business, particularly in this country. And we need to be able to talk to the business leaders in healthcare about what our value is.
Could not agree more. I love a while ago, and I was trying to think back when you posted it, but you posted something about, every time I Google the term pharmacist, I get them like filling the vial with the pills, and I don't do that every day. And so you launched this campaign to have everybody talk about we as pharmacists, what we do, but so many of us don't work at the traditional retail setting. We're out either upstream or downstream, to use your terminology. We are not filling prescriptions. We are trying to help patients in many other ways. So I applaud you for that and commend you, because you really are working in a space that I think is the future of pharmacy. Even though you're doing it each and every day, a lot of us aren't quite there yet. So thank you for sharing your story, Kelley. And with that, let's have our audience, and please share where you like to connect with people and they can learn more about you.
I would love to connect with everybody on LinkedIn. That is my favorite place to be, my favorite place to tell other pharmacists to be as well. That is where the business leaders, particularly in healthcare, hang out. And I think we need a bigger presence there. So please come find me and send me a message on LinkedIn. I'd love to connect.
Well, with that, Kelley Carlstrom, the future of pharmacy is actually here in the intersection of IT, oncology, and pharmacy practice. Thank you for sharing your expertise with our audience today.
Thanks, Erin.
You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.